Okay, so today we're talking about the 2025 crisis that's happening regarding autism services. Did you know there was a crisis happening? Yeah, there's a crisis happening. Autism support services are like going away. Have you noticed? Families are feeling like they're being left behind when it comes to autism support services. So, what's happening? Why are autism services getting worse in 2025? Let's talk about it, okay? And let's talk about what parents can do about it, okay? So, there are a couple things happening. And the first thing is that there are significant funding reductions in key agencies. Yeah, there are budget cuts to the Department of Health and Human Services, the HHS, and the National Institutes of Health, the NIH, and the Center for Disease Control, the CDC. That's been happening since the beginning of the year. And these cuts threaten initiatives targeting autism, chronic diseases, and other critical health areas. As of right now, approximately 20,000 employees have been either laid off or reassigned. This downsizing affects various programs, including those related to autism research and support, potentially hindering service delivery and research advancements. So, there are a number of federal programs throughout our country that help with autism programs and development. But there are significant programs that families and children rely on, and they are being cut. So, what's happening is parents are either the children are in the programs already and they're being kicked out. The parents are on waiting lists for these programs and they've been kicked off the waiting lists, or there are no applications. Yeah, that's what's happening. And the only reason why I'm not speculating. Anything that I say, you can go online and you can look it up yourself. But the reason why I'm seeing this, I'm seeing it in the parent groups. They are the ones reporting this. They're like, I don't understand what's going on. This happened to me, and this. I'm like, what is going on? And then whenever I look it up, I'm seeing that this is like happening in real time. Okay. What else? Medicaid service reductions across states. Many states are implementing cuts to Medicaid spending, affecting services such as dental care, personal assistance, and rehabilitative therapies. These reductions are forcing families to remain on long waiting lists and are leading to the loss of qualified staff due to job eliminations. Have you heard about that? I heard about that. So, for instance, one of the main services that many families depend on regarding their autistic children are the ABA therapies, the applied behavioral analysis therapies. It's they're the therapies that the children go to help with their behavioral health, right? Some states have already introduced caps on ABA therapy hours and reimbursement rates. So I read a parent a couple days ago. She was saying that her child does ABA X amount of hours a week, like, so many hours a day, and they cut her child's hours to cap them at only 30 hours for the year. So that means and only so many hours per week. And so she's like, my child is going to digress. I know she is. What do I do? And everybody had all the, like, you need to call this person, you need to do this, but at the end of the day, they're just cutting. You know what else? And this isn't even in my notes. They're also cutting Social Security. People who I did a live some weeks ago talking about your child should not be denied Social Security. Social Security has funds set aside. Social Security disability or Social Security SSI has funds set aside for children with disability. It's what our government has been doing. Hassan's been on disability, Social Security disability since he was little, and it has nothing to do with the parent's income. We owned a house, we had cars, we went on vacation, we did all the things, we had the money in the account, and I saw parents saying that we have two cars, so they denied us. We have money in our savings account, so they denied us. We got our tax income back, so they denied us. And I'm like, this should not happen. Well, it's happening, and it's happening because they have cuts to Social Security disability even for children. Or what's happening is parents are getting Social Security and then they're cutting them without any notice, without anything, without any explanation. They're cutting it. And people are like, you got single moms with more than one child with autism at home. They're like, I can't afford, I need that check for my child. I need Medicaid, which is the health insurance that will pay for all the therapies and all the doctor's visits. But they also need that extra check because the way the economy is, you know, doing out here. But you know what I mean? Having a child with autism is just, it just costs more. Okay. And they're cutting these programs. Okay. So, what does this mean? There's an impact on families. Okay. These federal and state level changes are collectively placing additional burdens on families of individuals with autism. And this is from children to adults. Okay. Reduced funding and service limitations are leading to increased out of pocket expenses, longer waiting periods for essential services, and heightened stress levels among caregivers. The uncertainty surrounding policy shifts further complicates planning for long-term care and support. And this is not just for small children. This is for teenagers and adults as well. We're talking about transition to work programs. We're talking about work skills, programs that are helping young adults find jobs. All kind of programs. Okay. While state and federal resources can be helpful, private therapies, online support courses, and parent training often offer advantages that public systems struggle to provide. Okay, so let's talk about the advantages that public systems struggle to provide. So we're talking about the private providers, people who provide programs that are not federally funded. Okay, number one, faster access to services. Okay, no. Oftentimes there are no long waiting lists or time frames. Okay, found in public systems. Parents can start therapies or courses almost immediately in most cases, without months or years or even weeks of delays or for evaluations or approvals, which is great. Many times parents who have children with autism, whenever they sign up for a program, they need to start ASAP or last week. You know what I mean? And a lot of times these parents will sign up and they're like, oh yeah, sure, yeah, you can get on that waiting list. The waiting list is about 2 years. And they're like, what am I supposed to do for 2 years? Next, personalized and flexible care. Private providers often offer customized treatment plans tailored to a child's specific needs and strengths. And this is a plus for parents because too many times you'll put your child into the system and it's systematic. And it's like, you're sitting in the meeting and they're like, okay, so this is our process. And you're like, can we tweak it a little bit? And they're like, sorry. They tell us this is the way we have to do it for everybody. And you're like, so in order for my child to be in this program, this is. But a lot of times private providers, because they're not, controlled by the system, they kind of just, can work with the parent to do what they need. Online programs and courses allow parents to choose what fits their child's learning style and development level. which is a great thing. Convenience and flexibility. Online support courses can be accessed anytime, anywhere, which is especially helpful for working parents, especially those in rural areas. So you don't have to drive 100 miles to get to the pristine, program that everybody's been talking about. You've been on the waiting list for 5 years. Yeah, you can go online and do it. You know what I mean? Sessions can be scheduled around the family's daily routine and not dictated by school or government calendars, which is excellent. Next, more communication and support. More communication and support. Private providers tend to give more direct communication and personal attention to families. How many times as a parent have you been involved in a governmental or federal program, and you have your little session or whatever, and they're like, oh yeah, if you have any questions, just you can reach us at this number or at this email address, and you're like, okay, great. And then you call the number and like they give you the runaround. You're jumping through hoops. It's whatever time, and they're like, oh yeah, leave us a message, and nobody ever calls you. I need an answer. I have a simple question. Just answer the phone. Get back to me. A lot of times, private providers, are more accessible. Parent coaching programs often include real-time support, feedback loops, and practical strategies for home use, which is excellent. Next, more innovative and up-to-date approaches. This is key. Private and online providers are often more current on the latest autism research, therapies, and technologies. You would think that whenever you have your child in school or if they're in a federally funded program, that these are the professionals. They know all the things. No, they have the curriculum that was approved from 10 or 20 years ago, and they've been using the same. If it ain't broke, no, they've been using the same approach that they've been using, or that has been working in other states or other jurisdictions with other children. They're not up to date on the latest research. Not necessarily. And this can be problematic for a number of reasons, but mainly this. If we're finding that something specific doesn't work or is problematic, they're not updating it. They're still moving forward with it, and your child is right in that program, and they're still using the same old stuff that no longer is effective or is doing more harm than good. You want to be able to have somebody who's up to date on the latest, okay? And private and online providers are more likely to offer holistic and neuroscience-informed or multisensory approaches than public systems that may not fund or recognize. And when we say holistic, we're just talking about it's not medicine-based. You know what I mean? It's not that they're necessarily feeding you herbs and vitamins necessarily. And if that is an approach, that's one other option that they might have, to talk to you about. You want all the options so that you can have choices, right? But I mean, we don't want our only options to be either you take this medicine or Johnny's just going to be out here just having tantrums, banging his head on the wall. Pick one. You know what I mean? You want a variety of options, right? Next, empowers parents as the experts. And to me, that's key. That's key. I'm the parent. My child's biggest advocate. I don't want to be the one showing up at the IEP meeting and everybody in the room is making decisions for my child and I'm just signing wherever you guys tell me to sign. No. I'm the parent. I'm making decisions for my child, not you. Empower the parents. I'm team parent empowerment. That's all I'm here for. I'm a parent and I encourage all parents to be. To me, that's what advocacy is all about. Parent-led courses put the power back in your hands, equipping you with tools to support your child without having to rely solely on outside systems. That's number one. If the parent's not in control, or at least if the parent doesn't feel in control, the parent cannot, the child's not going to get what they need. Period. I don't care how good the system is. I don't care how good the school is. I don't care how good the program is. If the parent's not empowered, the child is not going to be where they need to be. Period. This builds confidence, connection, and consistency. 3 things that truly change outcomes. Please let the church say amen on that. Okay? Period. Next, access to broader communities. Online communities and private networks connect parents with other families worldwide facing the same challenges. Schools and federally funded programs don't do that. You end up meeting other parents who are in the same programs, but they do not, they don't do, they're not, what's the word I'm looking for? They're not trying to collaborate and connect parents to unify them to build something. Does that make sense? When private providers are attempting to get you guys, they're trying to establish a community of unity amongst parents. They're trying to gather you to get you together to establish you so that you can be unified and so that you don't feel alone in this journey. Does that make sense? I hope I said that right. These spaces are often more empathetic, encouraging, and creative than traditional systems. Yeah. Next, less red tape. No need to prove your child's struggle repeatedly, to qualify for help. I can't tell you how many times I've sat in meetings at the school and they're saying what they're saying, and I'm like, no, he doesn't need that. And I could tell that they're saying what they're saying, and they have whatever they have in his IEP because this is just what they do for all the kids. And so I have to say, no, can we change it to this because this is what he really struggles with? And they're like, we don't really see that. And I'm like, well, you don't see that because you don't live with him. But I'm asking you that since he spends 7 hours a day here in school, I would prefer for this to be his goal instead of whatever you wrote there on that paper, because that's what all the other kids, that's what you put on everybody else's IEP. And so now I have to sit here and come up with examples, and they're sitting there looking at me with a blank stare on their face like, yeah, that's not what we experience. And I'm like, I'm not asking, this meeting is not about your experience. This is about my child and what he needs. Why'd you invite me to the meeting if you're not going to listen to what I have to say about my child and what his needs are? You know what I mean? I don't want to have to prove my child's struggle to you. You avoid the bureaucracy, outdated policies, and inconsistent services that come with state or federally funded programs. It's exhausting. Next, with these private providers, you get more understanding. Many private providers have more personal experience with what you're going through. Listen, I'm here. I've been talking to y'all about raising a child with autism for almost a month because I have an experience with raising a child with autism, and I'm trying to help you do the same thing. I've had success, and I'm talking to you about my experience with success. A lot of times these programs, these federally funded programs, these state programs, these schools, they have these professionals who learned what they learned in school, and now they're trying to help you. I'm not saying that they don't have, any, knowledge. I'm not saying that. I'm saying that sometimes someone who's been through it understands, and they can guide you in a way that some of these federally funded programs can't guide you. That's what I'm saying. These providers can identify obstacles uh, on how to navigate them based on experience instead of whatever they read in a book or what some other families went through. Sometimes that's what you need, period. And lastly, private providers are not confined by industry standards. Private providers are not forced to have students meet school district or state rules regarding certain treatment goals. Sometimes those programs, the state funded programs, are trying to push your child to meet a standard that the district has for the children in the classroom. I think what parents don't realize is that schools get certain amount of funds for the programs that they have in the school, especially for the children with disabilities. So what the district will do is they'll give them funding based on certain milestones that these children with disabilities can meet in certain time periods. So what they'll do is they'll push your kid to meet these milestones so that they can get the funding. I'm telling you what I know. So a lot of times these IEP meetings and your child's goals don't have anything to do with your child at all. This is the stuff they don't want you to know. A lot of times your child's IEP is funded based on the funds that the school needs, that the district needs. They get more funds if your child. Oh, I can see that I just taught you something you didn't know. Yeah. Private funders meet the parents where they are and let them know what their child's possibilities are. And that's the goal. It's not about funding that they're getting from the government. It's about your child progressing and meeting their goals that you set for your child. Yeah. So, we talked the other day about being proactive instead of reactive. So, if you want more information about a private provider, you can go to my website and look and do some research about what I offer to parents, okay, before more happens in the government, in the federal funding, political program climate. And again, you can go to TerayWard.com. I'll drop that in the chat to see if it's a good fit for you and your family and your child. Okay? Thanks for watching. I'll see you in the next video. Bye for now.